What can be even better than preventing COVID-19? It is preventing both COVID-19 and cancer at the same time. Have you been postponing your preventive cancer screening tests until after the coronavirus is over? If yes, this video is for you. Here you will find the 3 reasons why it is so important to ramp up your cancer prevention right now. You will also learn about the 3 tests that simply cannot wait until the new normal. My name is Vera. I'm a passionate cancer prevention educator, a former marketer of anti-cancer medicines, and a mother of 3. On this channel, Cancer Worry Free, you will find information about best practices in early cancer screening, advances in cancer prevention, and health hacks to help you lower cancer risk for you and your loved ones. The one thing that cannot wait until after the return of the new normal are your preventive cancer screening tests. There are 3 reasons why. First, we live in a world where about half of the people we know will eventually get a cancer diagnosis in their lifetime. During the pandemic lockdown, the anxiety, the isolation made many people turn to unhealthy sedentary habits for comfort. Let's look at some worldwide statistics from 2020 on the 5 unhealthy activities that contribute to the majority of the cancer diagnoses. They are tobacco, obesity, alcohol consumption, poor diet, and UV radiation from the sun. They're also known as the Big 5 cancer risk factors. 1 in 4 smokers increased their tobacco consumption. 1 in 2 gained weight under the lockdown. 1 in 3 drinkers increased their alcohol consumption. 1 in 2 reported increasing their consumption of prepackaged processed food. People got exposed to more UV radiation from the sun. On average, they increased their time outdoors by 1 hour per day, but sales of sun protection products noticeably dropped. So if anyone was predisposed towards developing cancer before the pandemic, and on top of that maintained or increased any of these unhealthy habits, it is important to not delay cancer screening any further. Think about the fact that cancer screening can rule out the cancer diagnosis and give you peace of mind. When it comes to cancer screening, sooner is always better. Delaying cancer screening does not put cancer on hold. It only delays the knowledge of important information that can either put your mind at ease or empower you to take effective actions. In 2020, many people and hospitals delayed cancer screening to prioritize COVID prevention and treatment. So only fewer people got timely cancer diagnosis. Why does it matter to get a timely cancer diagnosis? Robust clinical trial data show time and time again that early screening has enormous benefits for extending cancer patients' lives. Over 90% of those people who got screened early and received either a colon or breast cancer diagnosis got to live and be considered cancer survivors. On the contrary, only a small fraction of those who got their screenings late had the same outcomes. On this channel, I want to motivate you to reap the benefits of early screening and live longer. Consider early screening as your key to longevity. If so far you have found the information in this video useful, remember to click the like button and consider subscribing to this channel. The third reason to not delay cancer screening any further is that after the return of the new normal, the hospitals will be overburdened with catching up on cancer screening procedures. You may even get a few months of delay just because so many other people made the call before you. It is important to act now and schedule your appointment for cancer screening sooner rather than later to beat the traffic to the cancer screening centers. At the beginning of this video, I promised to tell you the 3 most important tests that simply cannot wait until the return of the new normal. These are the tests for the 3 most common cancer types. For men, the most common cancer types are colorectal, lung, and prostate cancer. For women, the most common cancer types are colorectal, lung, and breast cancer. Here are the 3 tests that I recommend you schedule right after watching this video. The first test for both men and women is the colonoscopy. It is recommended for everyone over the age of 45 and needs to be done every 10 years. The second test for both men and women is the low-dose CT scan to check your lungs. It is recommended for everyone over the age of 55, especially those with a history of smoking or living in a contaminated environment. The low-dose CT scan needs to be done every year. The third and last test for men is the PSA blood test for your prostate. It is recommended for everyone over the age of 55, and if you are of an African descent, over the age of 45. The test needs to be done every 2 to 4 years. The third test for women is the mammogram. It is recommended for everyone over the age of 40 and needs to be done every year. Since January is Cervical Cancer Awareness Month, here is a bonus test for young women. Women over the age of 25 need to do their pap smear test and their human papillomavirus test every 5 years. I hope that the information in the video so far gave you the motivation you need to schedule your cancer screening appointments right now, because I want you to be cancer worry-free sooner rather than later. Why? Because the clock is ticking. Yes, it is. So let's do this. At the count of 3, you and I are going to take our phones, dial our doctor's office, and schedule our cancer screening appointment. How about that? Are you holding your phone? 1, 2, 3. I will see you in the next video. Until then, schedule that appointment, click the like button, and subscribe to this channel. Dr. Prabhakar